Brittany Maynard of California was diagnosed with a terminal brain tumor. Her and her husband moved to Oregon to take advantage of the Death with Dignity Act, which is the ability to self-administer lethal prescription medication to end life while having a terminal illness. The purpose of my presentation today is explaining how the media portrayed insensitive listening and a judging response of her choice. My credibility is Oral Interpersonal with textbook, Understanding Human Communication, and 2 online articles, which is Death with Dignity, the laws and how to access them, and Brittany Maynard, what it means to die with dignity. Over the next few minutes, I will discuss background information on the Death with Dignity Act, background information on Brittany Maynard and her disease, definitions of the concepts in our text, and my interpretation of these concepts, and an explanation of how Brittany's decision was affected by poor communication. Let's get started with some background information on the Death with Dignity Act that only 3 states at the time Brittany had to make her decision had an effect. Death with Dignity laws, states that had the act were Oregon, Washington, and Vermont. On October 27, 1997, Oregon enacted the Death with Dignity Act, which allows terminally ill patients to end their lives through voluntary self-administration of lethal medications. At this time, I will show my visual aid of the requirements of Oregon's Death with Dignity Act. Act meaning the Death with Dignity Act, or Measure 16, as adopted by the voters on November 8, 1994, must be an adult, at least 18 years of age. Must be prescribed by your attending physician, which has primary responsibility for the care of the patient and the treatment of the patient's terminal illness. Must be capable of making decisions. Patient must be able to take medication on their own. A physician cannot physically give the medication to the patient. A patient's illness needs to be communicated through counseling, meaning 1 or more consultations between state licensed psychiatrists or a psychologist, and patient making sure that isn't suffering from any type of mood disorder such as depression. The healthcare provider must be a person's licensed or certified in the state. Must be a qualified patient, which is capable patient who is a resident of Oregon and has satisfied the requirements of the Act in order to obtain the medication to end his or her life in a humane and dignified manner. Patient must have a terminal illness that has a prognosis of 6 months or less, and patient must complete the request in writing. After 7 days of writing the prescription, they need to turn in the documentation, and after 10 days of ingestion, the physician must do an interview. Brittany Maynard was born on November 19, 1984 in Anaheim, California. She then died November 1, 2014 in Portland, Oregon. On January 1, 2014, she was diagnosed with a grade 2 astrocytoma, brain cancer, and had a partial cranioscopy and partial resection of her temporal lobe on her brain. Cancer then returned in April. Diagnosis was then elevated to grade 4. Her prognosis was 6 months or less to live. Brittany wanted to live. She was a happy, married 29-year-old woman. She was married less than a year earlier. She wasn't depressed. She wasn't wanting to end her life. She was a terminally ill person in which cancer wanted her to die. If her outcome was death in the end, she wanted it on her own terms, and she didn't want to suffer in the end. She didn't want her family to suffer in the end either, and she wanted to die with dignity. Now that we all understand the background information of Brittany's situation and the Death with Dignity Act, let's move on to the definitions of the concepts from our textbook. Insensitive listening is the failure to recognize the thoughts or feelings that are not directly expressed by the speaker and instead accepting the speaker's words at face value. The way that I interpret this is unaware or showing little or no regard for other people's feelings and emotions. Judging response, a reaction in which the receiver evaluates the sender's message either favorably or unfavorably. And the way that I interpret that is forming an opinion of the message that the speaker is sending, most times in a negative way. This is a good point to discuss the major point of my speech and how the media portrayed Brittany's decision by using judgment and failure to listen to all of her reasoning on taking advantage of the Death with Dignity Act. Media portrayed the failure to have empathy and sympathy, and they have practiced insensitive listening with their own beliefs of suicide versus ending life based on own terms. Media made it look as she wanted to commit suicide. She didn't want to die. She wanted to live a long and happy life with her family, but she wasn't given that choice. She was given the choice to die with dignity. Not only did she not want to suffer, but she didn't want her family to see her suffer also. The effects of having a judging response can be forming the opinion that she was committing suicide and getting the easy way out. To me, death isn't easy, so by saying that, they're saying she's dying, but she also is suffering in the end. If you've been listening to my speech, you've learned how poor communication, judgment, and insensitive listening made Brittany's decision look different from why she really decided to die with dignity. The main idea shared in my speech today was the background information of the Death with Dignity Act and Brittany Maynard, definitions of insensitive listening and judging response, and also my interpretation of those concepts, and how I feel these two concepts affected the media and how they portrayed Maynard's decision. With the decision to make Brittany, she didn't have huge support from the media. The media portrayed her decision as suicide versus dying with dignity from her terminal brain cancer. If media would have used sensitive listening, they would have realized she had no chance of living, even though that's all she really wanted. People are always so judgmental with their own opinions of others, they lack the opportunity to be empathetic to another person. Thank you.